Okay. Started the timer and here is your question.
Okay.
Right. If you have read and understood, kindly begin your communication skills station.
Hello. Hello, my name
Hello.
is Muhammad Kashif. I am one of the surgical doctors working in Extend and Emergency Department. May I know who am I speaking to?
You're speaking to the ITU registrar.
Oh, yes, I was calling for you, sir. Sir, I want to consult regarding a patient which we have received in Extended Emergency Department to take your advice and to request for an ITU bed if that's available.
Okay, so please summarize your case. Present your case.
Okay, so, sir, so this old lady, about 76 years old, has presented an emergency. She is a known case of COPD and she has some presented with complaint of abdominal pain and on further investigations, we are suspecting that she is suffering from acute abdomen.
Okay.
And we are planning to do a midline laparotomy. So I was calling to request your advice as she is taking steroids already and considering her COPD status and her medications, I was going to request you for ITU bed.
Okay. So from the notes, what her labs?
Patient has got high TLC count and low platelets, and also that she is suffering from metabolic acidosis, and otherwise her lactate levels are slightly raised, and on examination she has a tense tender abdomen, and yes,
Okay.
and her
So you
and electrolytes are all normal.
so she's in metabolic acidosis. You said.
Yes, she is suffering from metabolic acidosis.
And she's on steroids.
She is already on steroids.
Okay. So what is your reason for wanting to transfer to ITU? What are the risks in this patient?
As the patient is taking high dose steroids, the patient is likely to suffer post-operative complications of Andersonian crisis, and she is likely to suffer from cardiorespiratory complications and cardiovascular complications. Also, she is likely to have delayed wound healing and wound infections. And operatively, she may go into respiratory compromise, and additionally, she will be needing invasive monitoring,
Okay.
for which ITU admission is required.
Okay. So how about is there any intro and then post?
Yes, please.
What are you worried about intra-op and then post? What would you do?
Intraoperative, I am worried about that. I will ask the anesthetist to give him a regional anesthesia or if that's possible, we may go with epidural anesthesia, so her respiration is not compromised. And post-operatively and pre-operatively, I will give her additional dose of steroids to cover the period of surgery, and post-operatively, I will continue with the steroids, and also I'll consult the uh, uh, medical people for advice regarding the tapering of the steroids or the continuation of the steroid dose.
So, mentioning all that, what if there are no beds available? What would you in the ICUs?
So there are no beds available. Okay, so
Yes.
okay, so in the meantime, I'll continue the resuscitation of the patient, and we'll go with our planned surgery, and additionally, I'll ask the next nearby hospital for if there is bed available, and proceed if that's okay with you. And I wanted to ask your advice about the steroids, as she is taking steroids. So what should I do about that?
Okay, so what do you want to do with steroids?
So so I'll give an additional dose of hydrocortisone, and additionally I would continue steroids post-operatively, and do vitals monitoring, input output monitoring, and invasive monitoring of your cardiovascular status. And yes, that's it.
Okay.
How would you restrict
right now
the fluid? Yes, sorry.
So yeah, fluid restriction. Just how would you restrict the fluid?
So I will. Yes, I will. Yes, I will give her. I will give this patient Foley's catheter. I will insert a Foley's catheter in this patient, and additionally, as I am planning to insert the central venous line. So the fluid will be given according to the response and according to the CVP line. CVP line pressure. So
are you the one inserting the central line, or you're sending to us to insert it when the patient arrives?
Yes, when the patient arrives at your end,
So what's your criteria for ITU admission in this patient? Or in general?
Okay, as the patient is old and she has poorly controlled COPD, and additionally she is suffering from metabolic acidosis, and that's why these are the criteria for ITU admission.
Okay, and you need one-on-one care, right?
Yeah.
And then also, what kind of mask would you be using?
I will be using a non-rebreathing mask with about.
Okay, that's all right. You can transfer in the patient.
Okay, I'm thankful to you, sir.
Yes, we'll get prepared.
Okay, I'm thankful to you for your cooperation. Thank you. I'll transfer the patient.
Okay, good. Can you give feedback first, Dr. Fatima?
I think he was good in answering the question. That's all I have to say.
Yes, Dr. Abhishek, would you want to give feedback?
Yeah, it was really good, ma'am. But I think in the examination, the scenario will be a little more. There will be more
detailed
situation. Yeah, more detail will be there about the hypokalemia and the acidosis, everything. And there will be also maybe a diagnosis, some kind of perforated viscus, so that the examinee can go according to this, something like that.
Yeah, he did say there is abdominal. Yeah, but then
He gave it to me. He gave me the labs, and then but I guess like he knew what he was saying, so that was why. But in case it's
Dr.
not there,
Fatimata, have you asked about the
forget-
plan of management?
No, she did. Yeah, but
I
I'm not
asked him,
happy the
he
way
took it-
Dr. Kashif gave.
Yeah,
Like
Yeah.
I
pre-op.
asked him about pre-op,
You should.
Yeah.
intra-op, and post-op. I asked him about.
Pre-op, he had to contact anesthesiologist and
Yeah, that's the last
This patient should be
yeah.
monitored. Yeah, patient should be monitored.
Like he should have told about the airflow and all about the oxygen flow level and the steroids and about the preoperative monitoring.
And to make
side,
sure
like,
if patient has taken a steroid inhaler that particular day, that is
course,
important.
And about if there is no bed, there will be only single answer, Dr. Kashif, like you will monitor the patient as till the availability of the bed post-operatively. And I think transferring to another hospital, that will not be mentioned in the STEM, so better not say it.
Did he say that? I didn't
He said.
Don't transfer it.
Just monitor the patient until there is bed available. Okay.
Yes, you monitor. You don't transfer.
Yeah, you have to monitor in recovery room.
Yes.
The bed is available.
So there is no option to send the patient to another hospital here.
Yeah, we know that is rational, but in the examination.
Okay.
Okay, that's all from my side, Dr. Kashif. Just go through the notes several times. That will help.
Yeah.
Definitely.
He knew the labs. I just realized I hadn't written anything. Just the steroid.
Yeah, ma'am.
It was empty.
True. Like there will be more details.
More, definitely.
Yeah. Also, there will be questions over the potassium supplementation and the fluid resuscitation, all these things.
Yes, because of hypokalemia.
Yeah.
And then there was this question about ultrasound, free fluids in abdomen, chest X-ray.
Yeah.
So
Yeah, preoperative
yes.
means investigation or
Yes.
whatever. Yes.
Good, thank you. Okay, started the timer. Here, timer is more like you can get 2 or 3 minutes because there are many slides. So I'm starting with 2 minutes. Slides are more. So please, once you have read, tell me.
Okay.
I told you there are more time, more slides.
What is SAU? I don't understand now. SAU.
Sorry, I must have forgot.
Okay, next.
Next,
Yes.
the 10 I wrote. I didn't even change the date. Next,
Next. Okay.
Next.
Okay. Yes.
Yes.
I forgot the first one. I have to go the previous. Before that, okay.
This is the first one. This is nothing, just a lay explanation and information. Gave you approximately 4 minutes to read all the slides. 15 seconds left, then we'll begin. If you're ready.
Just next slide, ma'am.
Yes. Yes, good.
Okay.
Right. If you have read and understood, kindly begin your communication skills station now.
Hello.
Hello, yes.
Yeah, I'm Dr. Suman Kumar, one of the CT2. Am I talking to the consultant on call?
Yes, I am Kashif. I am the senior consultant on call.
Yeah.
How may I help you?
Yes, sir. Actually, I want to inform you about and take some advice about a patient who came to the emergency department to complain of abdominal pain on 26th.
Okay.
Okay. And I checked the patient and find that there is a raised, he's febrile with a temperature 38 degrees Celsius, and also he has got the dyspnea, and we are giving him oxygen by nasal cannula. He's also got tachycardia with 120 per minute, and there is atrial fibrillation, as can be seen. He has got breath also. The he has got abdominal pain and tenderness also. There is we have done the CT scan also, but still we are awaiting for the report. And,
Okay, so okay.
Even after giving these all, we have sent some blood investigations also, and his condition is still deteriorating. He has got the vomiting and.
So may I know why the patient was admitted and when was he admitted in our unit?
He was admitted yesterday at around, I think, nearby 10 o'clock at 9:30 and near 9:30, and then I saw the patient at 10:30 in the night. So.
Okay. So, what do you think? What's the complaint with the patient? What's the provisional or differential diagnosis?
Actually, I am waiting for the CT scan report, but I think it's gastroenteritis, or maybe the ischemic colitis of the patient, or since there is a with hypovolemic patient, maybe in the hypovolemic shock also.
Okay. So what were the input-output records?
Actually, we have given the fluid we have given 3 liters of crystalloid fluids since we admitted him, and still the urine output last night is around 40 ml only.
Okay. So have you checked for the have you checked the urinary catheter?
Pardon, sir?
You check the catheter.
Okay, so
It's
he has
blocked
only 40 ml. Have you checked the
yes,
catheter?
sir. Actually, I have checked the catheter. Catheter is, I think, intact. It is not.
Okay, so what is your plan now?
Ma'am, can I
What
see
is
the
your
next
plan,
slide?
sir?
Yes, please.
And as he has a history of meal at the restaurant, and also he has got some dark urine and some skin changes. I think he is getting some infection due to food or something. So we'll plan to start the antibiotic also, sir.
Okay,
and
so
we are
what is
waiting.
your plan? What is your plan?
First
What is
of
your
all, we
plan
will
now?
give the more fluid to make the patient fully hydrated, and then after that we will test the antibiotics, and then we'll see the response of the patient. And by the time the CT scan report will come, and we will plan accordingly.
So, is the patient in sepsis or a septic shock?
We are considering in that line also, sir. So we are also planning to send a blood sample for culture, and before we'll start the antibiotic, I'll send the blood investigation, full blood investigation again, to see the full blood count, urea, electrolytes, and also send the blood culture to see if, and then only I will start the antibiotics.
Okay. So, can you please ask the radiologist to give an early report of the patient?
Ma'am, can I see another slide? Next one. No, next one. Okay.
So what's the fast?
Sir, I'll talk to the radiologist if he can give the early report to this patient, as he needs to be assessed according to that report, sir.
Okay. So is the patient suffering from any other conditions, or is she taking any medication?
Patient is also is hypertensive and hypercholesterolemia, and ma'am, can I see that? And known hypertension. No, next slide. Next slide. Drugs.
Okay, drugs.
Yeah, actually, it is difficult to remember this one. Actually, he is non-hypertensive, and he's taking this the same lisinopril and prednisolone also, along with the lipid-lowering drug, because he's also having hypercholesterolemia. So he's taking the simvastatin also, sir.
Okay. So can this be due to him taking the prednisolone, this condition?
Sir, as we are taking the septicemia also, and he was on the prednisolone, so we can change it into the injection hydrocortisone, which will help in controlling the septicemia if there will be septicemic shock.
Okay, so additionally, I think you should continue with vitals monitoring and days for an early city report, and additionally consult the medical
Sir.
and the anesthesiologist for a theater.
I'll inform the medical consultant also regarding this patient, and I'll request him to come and see the patient.
Okay, so please keep me posted for any updates.
Yeah, sir.
And
I'll update you. Yes, sir.
And give him fluid challenge.
Okay. Thank you, sir.
Okay.
Thank you.
And,
Good.
Ma'am, actually,
there was no labs. There was no labs, no full blood count.
The problem
no
is,
all of a sudden, too much information.
Actually, problem is to remember what was in the first page, what was in the second page.
Yeah.
That's so.
You should have taken some notes because
actually,
the information.
it should have at least 5 minutes, and I should have taken
I gave you 4 minutes to read.
Then I could have presented better.
Yeah.
Plus, additionally, if the patient was admitted since morning and we are examining him at night, so he must have some labs also. And
he did have labs.
Yes.
Or no?
No.
No labs.
About the labs.
I missed the labs again.
No, I mean, it's all right.
Yeah, labs.
Dr. Suman, you tried your level best. It was good.
It was good. It was good. Both of you.
I'll go through this video again and I'll see what
labs
questions and what answers can be given. Yes.
Yeah.
And
was a good
discussion. From where, ma'am? May I know?
I don't know. I don't remember. I did it last year. And yes, I don't remember now.
Yeah.
But I have missed the labs in it.
Yeah,
now I'm getting the feedback. At that time when I presented this, no one gave me this feedback that labs are missing.
Yeah. Labs are missing initially.
Yes.
At the time of admission. So
but labs was there, it would be more.
Maybe it was deliberate because sometimes they don't give you everything in their booklet for 9 minutes, and then they are asking and you say, okay, I'm not sure, I'll get back to you for the lab. So maybe it was that kind of scenario.
Okay. Yes.
But actually I have seen this patient previous night, so I should know more about this.
Yeah,
that is the thing.
Yes. And examination was done by you.
Yeah, examination was done by me. So
trust me. Ma'am, I just said one line like in poetry writing part.
Yes.
Everything is written like this, ma'am. Trust me.
Really?
We have to write the referral letter. Yeah, I thought that. Oh my God, it's just similar to that about the fasting and everything.
Okay.
So this will help them to pass OAT.
Yeah.
Okay. Good. The timer, and there are 2-3 slides, so please ask me once you have read this one. Yes? Next?
Yes, next.
Next?
Okay. Next.
Yes.
That's all. This is a new
Yes,
new
that's
station.
it. Yes, that's it. So if you are ready, we can begin. Yes?
Yeah.
Okay. If both of you are ready, I'm starting the timer now. Please begin.
Just before we start, I tried
Yes.
to convince you to stay in hospital. She want to discharge.
Yes, this is
Oh, this is station, yes?
self-discharge. Yes.
Okay.
Yes, please begin now.
Could I begin?
Yes, please.
Good morning.
Good morning.
Hi, Mr. Lewis. I'm Dr. Zaid. I'm one of the surgical doctor here.
Oh, nice to meet you, Dr. Zaid.
Me too. I was told by the nurse you want to go home.
Yes, Dr. Zaid. I actually don't know why I'm here, and I don't want to be in the hospital.
Yes, I will explain everything for you. But before I start, could you tell me so far what you know so far about your condition?
I don't know. I just basically came here with like a tummy ache, and so they've got me admitted. They told me I can't eat anything, and they've been like giving me fluids through this weird thing on my hand. So I don't want to be here. So yeah.
Yes, you are right. You have a tummy pain. This is a result of pancreatitis. Pancreas is an organ in your tummy here in this place.
Okay, so
And
no one told me about this
I'm here
pancreatitis before.
to told you that this is pancreas is sometimes inflamed or painful when you are drinking alcohol. And and in this case, we should keep you here under observation until you are ready to go home, because your blood test come back and the blood test
I think it showed a high amylase or something.
yeah. And you have a blood test showed you have a raised of amylase. Amylase is an enzyme secreted by this organ.
Okay, so what is beneficial if I stay in the hospital? I mean, what can happen if I don't stay here?
Yes, this is a good question. Stay in hospital under observation until this mark is low down, because we need to do for you serial test, serial examination. Sometimes your condition may be worse.
Okay.
And also in the meantime, we need to review to prevent the next attack can be having again. For example, you should stop drinking. If you are smoking, we are looking after what the cause due to this incident. Yes.
So how long are you going to observe me?
I don't know exactly. Just we will keep you here 3 to 5 days until everything is settled down and you are be ready to go home.
All right. And so sorry, you went over the complications that can happen if I go home, right?
Yes.
Okay. And what will you be doing when I'm staying in hospital? You said something about monitoring blood tests.
Yes, we do for your serial abdominal examination. We said for your blood test. We give you an IV fluid if you have any fever or raise your temperature. We give you antibiotic. We will also let you start your oral diet under our observation. If you are you can't tolerate this food, we can change it to give you a food throughout tube.
Okay.
Until everything is good and we are sure you are safe, you can go home and safe. We can discharge you.
Dr. Zaid, I'm also in a lot of pain. What will you, because you're not giving me anything to eat, what are you going to give me for my pain?
Yes, I will give you a painkiller. Don't worry, I will give you everything. Painkiller, I will now call the nurse to give you painkiller. And also, if you have any pain, just let the nurse know. She will give you.
Okay, I still don't want to stay inside the hospital. I'm really sorry. I know you've explained everything, but I would like to leave regardless. Is there anything we can do for that?
In this case, this is your decision. I know you can go home, but in this case, you should be on your mind. You have a full responsibility if there is anything happen in your home.
Okay.
And in case you are in a home, you have unbearable pain, or you can't eat, or you continue vomiting, or you lose, you are fighting, or anything like that, you can come back immediately to ENA and to here or near hospital.
Okay.
In the meantime, in the meantime, you should sign a legal form.
Okay.
Yes. That
what does that sign?
Yeah, that state you understand everything. I told you the complication could be happen, and you are go home and your responsibility.
Yeah, against medical advice.
Yes.
Is it? Yeah. Okay.
Yeah.
Yeah, I'm fine with that, Dr. Zaid. Yeah, I would like to do that now. Is that okay?
Yes, that's great. Just before I end, just let me recap what we said here.
Okay.
You come here, you have the stomach pain. From your examination and blood test, we diagnosed you as pancreatitis. Yeah, according to your case, you are not well to go home. We should keep you here more days, but you insist to go home. And I explain for you also what complication could be happen. If you have any one of this, you can come back at any time. Am I clear?
Yeah. Okay. Sure. Thank you, Dr. Zaid.
Okay. Thank you.
Okay, you still have 1 minute and 20 seconds, but then
Do I?
Yes, what more he could have?
Yeah, it's really
said.
the new case. I didn't know this before.
Yes, but still, what more we could have done? Patadine, she's already getting, and you were right. You said you will do the serial abdominal examination, and then yes, Dr. Abhishek. Kindly give feedback.
Okay, it's kind of discharge against medical advice, right, ma'am? Okay, Dr. Zaid, you tried very good.
Very
it was
good,
really
excellent.
Good from my side, yeah, excellent.
Even the
but
patient was good, both of them were, yes.
Yeah. You have told her everything, but in any case, like discharge against medical advice or any kind of refusal for anything, we have to cross-examine that if the patient is in sound mind, if the patient can retain information and can relay that. Okay. So in this case, try to ask the patient, can you please tell me what I have told you so far about your condition? So whenever the patient can tell everything, then you are you understand that, okay, the patient can understand his or her situation, and as the patient can understand this, then he or she can go home against discharge against medical advice. So you have to check the patient's mental status.
Yes, good.
Am I clear?
Very good.
You are right. Yes, you catch the point. Yeah, you are right.
So you could use that time in that way. Then you can also summarize. Did you the warning sign the patient could get after getting home, something like that?
I think he gave me the red list word, the red warning signs.
Okay, that's really good. And what is written in the notes in the legal form, you could after that something that your present condition and detailed hospital admission was advised, something like that, and you bear the whole responsibility. Like just 3 to 4 points. That's we have two Dharma station as like anything can come in the examination.
Anything. It was like
principle.
Regular one was that spleen rupture, but then I thought I should give something else.
Yeah.
Because people with acute pancreatitis, I've also seen leaving on their own. Even before they were normalized or regularized, they wanted to leave. I don't know why. I thought
Dr. Abhishek. Right, Dr. Abhishek, you mentioned 2 very important things. That one, the sound mind patient is competent enough to ready to give the decision. And second thing, the legal form to sign before you leave.
What does it contain?
Dr. Zed talked about the legal form.
Yeah.
Yeah.
Yeah, I think would like
But
just
the
describe
sound mind,
more
yes,
about, like,
he
the
could
things
have.
contained. Yeah.
Yeah.
In legal document also we have to describe that. We'll mention in the legal document that you understand this, you have this one, and you understand this, and you will be whole responsible for any complication like that. You are leaving the hospital on your own like this against medical advice.
That's it. Nothing else.
Good.
Yeah. Otherwise, he was good. Yeah.
It was excellent, yes, for both of them.
Thank you.
Good. Nice. You ready, please?
Yeah, sure, ma'am.
Sure, ma'am.
Okay. Here is the question. It's needless to say that it's breaking bad news. More than a year ago I wrote this. I didn't even update the date. Sorry. It's going bad with me. Right. If you have read and understood, kindly begin your communication.
Okay. Right. Hi, Mr. Adam. I'm Dr. Sankhya. I'm one of the surgical candidates for the exam today. So we're just going to have this short discussion about why we're called into clinic today. Is that okay?
Yeah, doctor,
Right.
I'm actually waiting for that. Will you please do that? I'm really worried.
Okay, I understand. It's been a long wait. So, Mr. Adam, do you know any reason of why you've been brought into clinic?
Yeah, doctor, I had some problem regarding taking food, and I had lost some pound of weights, and in last 2 months. Okay. And then I think, according to Mr. X, the consultant, he told me I have to go through an X-ray after taking some dye from my mouth.
Okay.
And yeah, I am just waiting for the results, and I'm really scared. Like, what may be the cause regarding this?
Okay. I'm really sorry, Mr. Adam, that you had all of these symptoms and it's been going on for 2 months. And I understand you're completely worried. So I'm essentially here today to tell you about it. Do you have any family or relative who you can bring across with you?
No, doctor. I actually came out alone today. I didn't take anyone.
Okay, fine. Mr. Adams, so I'm happy to discuss the results of the scan that you had gone through, the X-ray that you were talking about. That's perfectly right. So what essentially it showed in the X-ray is that it shows us a little bit of an abnormality in your food pipe. Okay.
Oh, okay.
I'm really sorry, but yeah, if you need some time for yourself, I'm happy to give you that time.
No, please,
yeah.
going on.
Okay.
Like, what abnormality? I just want to know, doctor.
So it just shows a bit of an abnormality in terms of like a swelling that's there in your food pipe. Given your age and given all of these symptoms, we are thinking about any possibilities of a cancer or a malignancy.
Oh, okay. Oh my God! Seriously? It's cancer?
I know.
Are you
this
so
can
sure?
be. Okay, we're not very sure. We're definitely not sure, but that is also one of the things that we're thinking about. Okay, this can be something else as well, like an achalasia. It can be something else.
I'm not really feeling well.
Okay. Do you want to take a minute, Mr. Adam?
No, it's all right.
Okay, so this is just one of the possibilities that we're thinking about. Okay, so in order to realize what it is, in order to understand what it is, we'll need to do another scan, which is called as a CT scan. So a CT scan will basically tell us more about the lesion or more about what the abnormality is. And it will also tell us if there is any abnormality in any other part of your body, which can be attributary to your symptoms.
Okay, doctor. Okay, so are you sure that it's a cancer?
So we're not sure. We can't be 100% sure unless and until we do this scan, and we need to do further investigations, which is the only confirmatory, investigations for a diagnosis. Okay, but this is also one of the possibilities that we're thinking about, and that's why I had to let you know about this.
Okay, so should I tell my family members that I have a cancer, doctor?
No.
Okay, doctor. So can you please give an appointment about CT today, or just I have to wait? You're gonna call me?
I think we might need to wait because you don't have any acute symptoms at the moment. I think we might need to wait for 2 weeks at maximum, but we will get it done within this 2 weeks.
Oh, okay. And so after the CT scan, when the report will be available, doctor?
The report will be available as soon as possible.
Please tell me, may I need further test? What type of test may I need after the CT scan?
So after the CT scan, you will need some, if the CT shows a lesion or any sort of a malignancy, we will need to do something called as a biopsy. That is along with all of your blood tests as well, just to make sure all of your blood work is normal. We'll also be doing LFTs and our liver function tests and renal function tests, just to make sure your liver and kidney is all fine. We'll be doing clotting profiles before your biopsy, just so that we know that you're not going to have bleeding or any, too much of side effects from the biopsy. So from the biopsy, we'll essentially know what kind of a lesion it is and how we can treat it.
So, doctor, at this moment, I really find it very difficult to eat anything. So, can you please do something for that? Something like any medication or any advice?
Essentially, I think we might need to admit you in if you're finding it too difficult to eat, and we might need to give you an alternative feeding option. Like it might be a nasogastric tube, or it can be a gastric. I think we will initially think with a nasogastric tube, because that might help you with the feeding.
Yeah.
If there's any way I can help you out, if there's any other questions you would like to ask, I'd be more than happy to answer.
No, doctor, it's all right. So I have heard just one thing, that there's some staging, like stage 1, 2, 3, 4 about the cancer. So can you please assume that, like, what may be the stage for if that is a cancer, what may be the stage, doctor?
I'm so sorry, but this seems like a repetitive answer, but I wouldn't be able to tell you more about the state until I get a proper scan, like a proper CT scan, because we need to check about lymph node and like nodal involvement and metastasis, which essentially means spreading out to other parts of your body. So we'll have to look at all of that before we decide what stage you're in. If that's okay, Mr. Adam. I'm so sorry, I couldn't help you with that.
It's okay, doctor. Thank you so much for explaining these things.
You were right, Dr. Vishek. She is excellent already. I don't know why she's worried.
I'm really panicking right now because I felt like it was a disaster. But
on the other side, it was Dr. Abhishek, but still you managed to handle him so well, so beautifully well. Yes. Anyone want to give feedback?
Dr.
Thank you.
Other than
from my side, Dr. Tankha, definitely you did really good. And the fact is, you asked about the family members. You just offered some time before that, and what I do actually, in regards to the breaking bad news. So at first, the patient is here for the investigation report. So I just prefer, we have done some investigation for you, Mr. Nick, and I'm really afraid the result that didn't came good. So So just stop after that. Okay, didn't take some time. After that, you can start again, and you can say you can tell the results. And as a patient, during digesting the bad news, like from the patient side, you are just talking from your side. So you just stop, let the patient say something, then you can. Don't worry about time. Okay. So that will just fine tune you. Okay, you are. Totally
She's already fine-tuned.
Like
she was
my
so
suggestion
calm.
from my
Yes.
side.
Yes.
Yes.
Yeah.
But
she was so calm.
Good. And I just produced much
questions
as far as I can.
Yeah.
Thank you, Dr.
Right.
for going easy on me, because if you had asked me for staging, I really, really did not know the answer, so I would have really blanked out.
Another thing,
No, but you covered it really well.
I asked some further investigation about all the things. You just, there was nothing about the OGD and biopsy in the notes. So to be on the safe side, you could just say that definitely I will, about these things, I'll definitely discuss these things with my consultant, and we'll decide further, and I'll let you know everything. So you could also tell these things, like, and also about the feeding options, you could also involve your consultant about these things. Because
fine.
And other than that, everything is definitely perfectly fine. You definitely passed this stage.
Yes,
okay,
she already passed.
Yeah,
definitely.
Yeah, right. Dr. Abhishek, what you told about that, first you give some indication that there is some bad news. So at that time, suppose the patient is standing, you can say that, would you like to see it? Means that something serious is coming. Or you can say at that very moment that, would you like to call to someone from your home or someone from your relatives?
He told, Dr. Suman.
Means, I mean, she told, yes, but later on, at the time of